Hi, I'm Grandpa Gerber, and I'm glad you're here. So, what's the skinny on visceral fat? Imagine your body as a house. Subcutaneous fat is like the walls of your house. It's there, but not really causing any trouble. Visceral fat, on the other hand, is like a sneaky intruder that finds its way into your house and starts causing all sorts of problems. It moves from room to room and creates messes, and those are the types of mess that don't get cleaned up. Visceral fat is the fat that surrounds your organs, such as your liver, pancreas, and intestines. It's not just sitting there looking unsightly, it's actually actively harmful to your health. Here are some dangers of having too much visceral fat. 1, there's an increased risk of chronic diseases. Visceral fat is linked to serious health conditions like heart disease, type 2 diabetes, and stroke. It messes with your body's ability to regulate blood sugar and cholesterol levels, increasing the likelihood of disease. 2, it creates inflammation. Visceral fat is like a factory that churns out inflammatory chemicals, causing chronic inflammation throughout your body. This can often lead to joint pain and an increased risk of cancer. 3, it causes insulin resistance. Too much visceral fat can make your body less responsive to insulin, the hormone that helps regulate your blood sugar levels. This can eventually lead to type 2 diabetes. And finally, there is a risk of metabolic syndrome. Visceral fat is a key player in metabolic syndrome, a cluster of conditions that increase your risk of heart disease, stroke, and diabetes. These include high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Now, you don't want to be obsessive about it, but it's important to keep an eye on your waistline and make healthy lifestyle choices to keep visceral fat at bay. Even when the walls get shabby on our house, we do a little preventive maintenance. Eating a balanced diet, staying active, getting enough sleep, and managing stress are all crucial to maintaining a healthy weight and reducing the amount of harmful visceral fat in your body. Because of its potential hazards, this was one of the first things I focused on when I began my journey. I knew that if I took care of the inside, the outside would take care of itself. On February 15th, my levels were 16 pounds of visceral fat, and all my other levels were way off. As of today, I'm down to 10, and losing those 6 pounds of visceral fat has made all the difference in my accumulated weight loss of 45 pounds. In addition, that loss has started my body on a metabolic reset. So where are you today? And if you know someone who could be helped by this video, feel free to follow and share and repost. Thank you for stopping in. Next video, we'll talk about the difference between type 2 and type 1 diabetes. Have a great night.